Technology is letting us see a doctor anytime, anywhere, but there are times when virtual health care may not be the best option for your health. So you need to know when it is. Dr. Brian Fedorenko is joining us now. He is the Southeast Medical Director for Priority Health. We thank you so much for being with us today.
Thank you for having me.
So when you talk about virtual care, I'm immediately feeling like it's like a teleconference with your doctor. Is this happening already?
Sure, it is already. We do it with our patients, and you can use services that are national companies that you can get the virtual care from. So it's just like a Skype visit. It's just like, you know, I FaceTimed my daughter last night from college. You know, you sit down, you kind of say, hey, I'm having this problem, I'm having this issue. What should I do? You know, so it just helps you kind of understand where you are. Mostly what we find is it's being used for acute things. You know, I have a rash, I have a cough, I have something that's happening.
So instead of going to the ER, say if you have a question that you want answered right then, this could be another option for people. Is virtual care available widespread already? Because I don't feel like a lot of people are talking about it yet.
There are a few national companies that you can use. Most insurance companies are starting to think or have an option for, you know, some national company that's around 24/7. So, you know, they're there all the time. Priority Health has their own MedNow that we use, and so you can get a hold of them at any time. For people with Medicare Advantage, seniors, it could be free. In 2019, we're going to be covering it as almost free. Or free, depending on their coverage. So depending on your plan, some people have employer-based plans. It could be $45. It's kind of a rough number right now.
Well, it is exciting. It's kind of like the changing world of medicine.
Sure.
How do you know when you need to go see a doctor in person?
Well, you know, that's the tricky part with this, right? That's the difficult part where, you know, if somebody's having chest pain, we probably don't want them, you know, doing a virtual visit with us. But my daughter was in college and she had a rash, and you know, I said, well, why don't you get on do a virtual visit? And so they prescribed a cream for her, and it was pretty easy, right?
So you can even get prescriptions through a virtual visit.
Right.
So you don't, do they email it to you? So there's just paperless, the whole thing?
We do, that's what we do all the time. We send our prescriptions electronically to your pharmacy anyway. So, you know, this is really just, I talk to you and then I get on my computer and I send my prescription out, so.
And to say, like, walking in to the pharmacist with a paper prescription now, that's old school now.
Right.
So if people want to try this out, should they talk with their primary care physician first?
Always. I think that if your primary care doctor has virtual visits available, that's always the best, right? Because they know you, they know your medications, they know your history, your family history. I would start with that. But if you're somewhere else, the virtual visits are good too.
Thank you so much,
Dr.
Fedorenko. We really appreciate it.